You wake up one morning with a splitting headache. Today, you'd reach for some ibuprofen, maybe see a doctor who'd prescribe antibiotics if needed. But imagine instead that your physician approaches with a blood-stained knife, no anesthesia, and a treatment plan that involves drilling holes in your skull while you're fully conscious. Welcome to 19th century medicine, where the cure was often far deadlier than the disease itself. This was an era when hospitals required patients to pay up front because survival rates were so abysmal that collection after treatment was nearly impossible, when surgeons would weep before operations, knowing the agony they were about to inflict, when the very tools meant to heal were caked with the bodily fluids of previous patients, and where a simple procedure could easily become a death sentence. In the next hour, we'll journey inflicted upon human beings, from surgeries performed through the most barbaric medical practices ever without any pain relief, to treatments that slowly poisoned patients with mercury, from bloodletting that drained the life from millions to experimental procedures that turned operating theaters into chambers of torture. These weren't the practices of primitive civilizations or medieval barbarians. These were the accepted medical standards of the supposedly enlightened 19th century, performed by educated physicians in major cities across Europe and America. But this isn't just a catalog of historical horrors. Understanding these practices reveals something profound about human nature itself, how entire societies can normalize the most extreme suffering when it's presented as scientific progress, how good intentions can lead to unspeakable cruelty, and how the very people trusted to heal can become agents of unimaginable pain. What makes these procedures truly chilling isn't just their brutality, but the calm, methodical way they were carried out. Surgeons didn't see themselves as torturers. They genuinely believed they were helping their patients, even as screams echoed through operating theaters and mortality rates soared beyond 50% for routine procedures. The religious doctrine of the time taught that suffering was divinely ordained. If God meant for humans to endure pain when injured, then interfering with that divine plan through pain, relief was seen as blasphemous. This twisted logic created a medical culture where causing agony was not only acceptable, but morally required. Let's begin with the most fundamental horror of 19th century medicine. Every single surgical procedure was performed without anesthesia. Imagine for a moment that you need your leg amputated. You're strapped to a wooden table, while 4 strong men hold you down. The surgeon approaches with a bone saw, its teeth still stained with blood from the previous patient. There's no medication to dull the pain, no injection to make you unconscious. You will feel every cut through skin, every grinding motion through bone, every moment of the 30 seconds it takes to remove your limb. Patients scheduled for surgery were like condemned. This was reality for millions of peopled prisoners counting down to their execution. They would spend days, sometimes weeks, in a state of pure terror, knowing exactly what awaited them. Medical records from the period describe patients going completely insane from fear before their operations even began. The psychological trauma extended far beyond the patients themselves. Surgeons of the era frequently broke down emotionally. They would vomit after procedures, shed tears before entering operating theaters, and many developed what we would now recognize as severe post-traumatic stress disorder. One surgeon wrote in his diary that approaching the operating table felt like walking to the gallows, except I am both the executioner and the witness to an innocent person's torment. But perhaps most disturbing was how this suffering became entertainment. Surgery was often performed as a public spectacle. Wealthy citizens would pay admission to watch operations from gallery seating, treating human agony like a theatrical performance. Even royalty attended particularly interesting procedures. These audiences would cheer for dramatic moments, gasp at particularly gruesome sights, and place bets on whether patients would survive. The operating theaters were designed like amphitheaters, with tiered seating surrounding the surgical table. The crowds brought with them the filth and disease of 19th-century city streets. Operating rooms became so packed that surgeons sometimes had to clear spectators from the floor just to have space to work. The patient, already enduring unimaginable pain, was also subjected to the jeers, gasps, and commentary of hundreds of strangers treating their suffering as sport. This entertainment aspect reveals something deeply troubling about human nature. When suffering is normalized and presented as educational or scientific, people can watch the most extreme torture with casual interest. The same crowds that attended public executions flocked to surgical theaters, finding pleasure in witnessing pain they would never willingly endure themselves. Among the most notorious figures of this era was Robert Liston, a London surgeon who embodied both the skill and the horror of pre-anesthetic medicine. Standing 6 feet 2 inches tall in an age when the average British man was barely 5 feet 6, Liston was a giant who used his size and strength to physically overpower struggling patients. He could amputate a leg in under 30 seconds, often holding his bloody knife between his teeth to keep both hands free for cutting. Liston's speed wasn't born from showmanship, but from compassion. He understood that every additional second of surgery meant more agony for his patients, but his frantic pace led to accidents that seem almost impossible to believe. During one infamous operation, Liston moved so quickly that he accidentally amputated his assistant's fingers along with the patient's leg. Both the patient and the assistant later died from gangrene that set in from their wounds. But the most notorious case in medical history occurred during another of Liston's rapid amputations. Working at his characteristic breakneck speed, he not only removed the patient's leg, but also sliced off 3 of his assistant's fingers and slashed through a spectator's coat. The patient died from infection, the assistant died from gangrene, and the spectator, believing he had been stabbed, died from shock. It remains the only surgery in recorded history with a 300% mortality rate. Yet Liston wasn't a madman or a sadist. He was considered one of the most skilled and compassionate surgeons of his era. His lectures to medical students emphasized the importance of minimizing patient suffering. The tragedy is that within the constraints of 19th century medicine, his approach was actually the most humane option available. The alternative was slower, more careful surgery that prolonged agony without significantly improving outcomes. The tools themselves were instruments of torture disguised as medical equipment. Bone saws with jagged teeth that would bind and tear. Knives so dull from repeated use that they required sawing motions rather than clean cuts. Forceps and clamps that crushed tissue while attempting to control bleeding. Most horrifying of all, these instruments were never cleaned between patients. Surgeons took pride in the accumulated filth on their tools and aprons. A blood-stained surgical coat was seen as a badge of experience, proof of how many operations a doctor had performed. The same knife might be used on dozens of patients in a single day, carrying infection from one victim to the next. Instruments were stored in cases lined with velvet that had never been washed, creating perfect breeding grounds for deadly bacteria. The concept of sterile conditions was not just unknown but actively rejected. When Joseph Lister began advocating for antiseptic practices in the 1860s, the medical establishment responded with overwhelming skepticism and hostility. Prominent physicians ridiculed the idea that invisible germs could cause disease. They saw no connection between their filthy practices and the astronomical infection rates that killed more patients than the original conditions requiring surgery. This resistance to change reveals another disturbing aspect of 19th century medicine. Pride and tradition were valued more than patient outcomes. Doctors had invested their entire careers in learning specific techniques and theories. Admitting that their methods were killing people would have meant acknowledging that they had spent decades torturing patients in the name of healing. The establishment's refusal to embrace cleaner practices wasn't just stubbornness. It was a system built on ego and reputation where admitting error meant professional destruction. Senior physicians had built entire careers on bloodletting and mercury treatments. To accept that their methods were fundamentally flawed would have meant acknowledging they had spent decades harming the very people they swore to heal. This institutional resistance created a medical culture where innovation was seen as heresy. Young doctors who questioned established practices found themselves ostracized from the profession. Medical schools continued teaching the same brutal techniques that had been used for centuries, passing down knowledge that was not just worthless, but actively deadly. The hierarchy of 19th century medicine functioned like a religious order, with senior physicians serving as high priests of medical doctrine. Their word was absolute law, even when that law mandated procedures that killed more patients than they saved. Students who dared question why certain treatments worked were told that questioning the masters showed dangerous arrogance. Consider the typical medical education of the period. Students lived alongside the corpses they dissected, often for weeks at a time. It was common to see medical students walking the streets with fragments of flesh, brain matter, or intestines clinging to their clothing after anatomy lessons. This constant exposure to death and decay created a peculiar numbness to human suffering that permeated the entire profession. The dissection rooms themselves were chambers of horror that would make modern morgues seem pristine by comparison. Bodies in various stages of decomposition were stacked like cordwood. The stench was so overwhelming that students would smoke pipes or chew tobacco constantly, not from habit but to mask the smell of rotting flesh. Rats and other vermin lived openly among the corpses, and students were expected to simply work around them. This environment produced physicians who were desensitized to human pain in ways that seem almost incomprehensible today. They had spent years surrounded by death, cutting into human bodies while those bodies leaked fluids and gases. By the time they began treating living patients, the transition from dead flesh to living flesh seemed almost insignificant. But nothing exemplifies the systematic poisoning of patients more than the widespread use of calomel, a mercury compound that was prescribed for virtually every ailment imaginable. From teething infants to dying elderly patients, mercury was considered a cure-all that could treat everything from constipation to typhoid fever. The reality was far more sinister. Calomel was essentially slow-acting poison disguised as medicine. Patients who received mercury treatments would begin drooling uncontrollably as their bodies tried to expel the toxic metal. Their gums would turn black and begin to rot. Their teeth would fall out. Their hands would shake uncontrollably, and many would develop severe neurological symptoms that we now recognize as mercury poisoning. The medical establishment interpreted these horrific symptoms as proof that the treatment was working. When patients began producing massive amounts of saliva, doctors saw this as evidence that the mercury was purging disease from the body. The more severe the symptoms, the more effective the treatment was considered to be. Some physicians measured successful treatment by whether patients could produce at least 3 pints of saliva, a volume that indicated dangerous mercury toxicity. The use of mercury on children represents perhaps the most unconscionable aspect of 19th century medicine. Teething powders containing calomel were routinely given to infants, causing a condition known as pink disease. Babies would develop swollen, bright red hands and feet that were intensely painful to touch. They would cry incessantly from the agony, but parents and doctors interpreted this as normal teething behavior. Thousands of children died from mercury poisoning, their deaths recorded as mysterious childhood illnesses rather than medical murder. The connection between calomel and these deaths was ignored for decades, even when the evidence became overwhelming. As late as 1950, pink disease accounted for more than 3% of all pediatric hospital admissions in London, and official statistics show that 585 children died from mercury poisoning between 1939 and 1948 in England and Wales alone. The persistence of mercury treatments reveals something deeply disturbing about medical culture. Even when physicians could observe that their treatments were causing obvious harm, they continued prescribing them because established medical doctrine declared them effective. The authority of traditional practice outweighed empirical evidence of patient suffering. Famous patients fell victim to mercury poisoning just like common citizens. Napoleon Bonaparte, Edgar Allan Poe, Andrew Jackson, and Louisa May Alcott All received mercury treatments that likely contributed to their various health problems and early deaths. Poe's erratic behavior and premature death may have been caused not by alcohol or mental illness, but by the mercury treatments he received for depression and various physical ailments. The scale of mercury use was staggering. Pharmacies sold mercury compounds like candy, with no restrictions or warnings about their toxicity. Patent medicines containing dangerous levels of mercury were advertised in newspapers and sold door to door by traveling salesmen. Entire families would be slowly poisoned by medicines they believed were keeping them healthy. But even mercury pales in comparison to the bloodletting mania that consumed 19th century medicine. This ancient practice reached levels of brutality that seem almost impossible to comprehend. Physicians would drain enormous quantities of blood from patients, often removing so much that death from blood loss was immediate and inevitable. The French imported 40 million leeches annually during the 1830s for medical purposes. England imported 6 million leeches per year from France alone during the following decade. Hundreds of millions of these blood-sucking parasites were placed on patients throughout Europe, draining the life from people who were already weakened by illness. Dr. François Broussais, a prominent Parisian physician, claimed that all fevers were caused by organ inflammation and could be cured by aggressive bloodletting. His treatment protocol involved placing dozens of leeches directly over whatever organ was supposedly inflamed, then following up with additional bloodletting using knives and cups. Patients who survived one session would often be subjected to repeated treatments until they were so weakened that minor illnesses became fatal. The extremes of bloodletting defy rational comprehension. Medical records describe cases where patients had multiple pints of blood removed in single sessions. One documented case involved a French sergeant who was stabbed in the chest during combat. Upon arriving at the hospital, he was immediately bled 20 ounces to prevent inflammation from his stab wound. The treatment was more likely to kill him than the original injury. The medical records paint a picture of systematic brutality disguised as healing. Bloodletting sessions would continue until patients lost consciousness from blood loss. Those who survived the initial treatment were often subjected to repeated sessions, each one bringing them closer to death. The logic was perverse but internally consistent within the framework of the 19th century medical theory. If a little bloodletting was good, then more bloodletting must be better. Physicians would make multiple incisions on a patient's arms, legs, and torso, allowing blood to flow freely into collection bowls. The sight of operating rooms after bloodletting sessions resembled battlefields more than medical facilities. Floors were slick with blood, and the metallic smell of iron hung heavy in the air. Patients who entered these rooms walking often left carried on stretchers, if they left alive at all. The tools used for bloodletting were as crude as they were dangerous. Fleams, sharp blades designed specifically for opening veins, were reused countless times without cleaning. Cupping devices, glass containers heated over open flames, and placed on the skin to create suction, would burn patients even as they drained their blood. The combination of blood loss and infection from contaminated instruments created a double assault on already weakened immune systems. But perhaps most disturbing was the application of bloodletting to children and pregnant women. Infants barely old enough to survive outside the womb were subjected to leeches that could drain a significant portion of their total blood volume in minutes. Pregnant women experiencing difficult labor were bled extensively, the theory being that reducing blood volume would somehow ease childbirth. The reality was that both mothers and babies died at astronomical rates from procedures intended to help them. The social pressure to submit to these treatments was immense. Families who refused bloodletting for their loved ones were seen as ignorant or cruel, denying their relatives the best medical care available. Physicians would shame family members into consenting to procedures that they privately suspected might be harmful. The authority of medical expertise was so absolute that questioning a doctor's recommendation was considered not just foolish, but morally wrong. Even more horrifying was the practice of trepanation, the drilling of holes into patients' skulls while they remained fully conscious. This procedure, which had ancient roots, experienced a resurgence during the 19th century, as physicians sought to treat everything from headaches to mental illness by releasing pressure from the brain. The reality was far more brutal than the theory suggested. Patients undergoing trepanation were strapped to chairs or tables, their heads held motionless by metal clamps. The surgeon would begin by cutting through the scalp with a scalpel, peeling back layers of skin and muscle to expose the skull beneath. Blood would stream down the patient's face as they remained awake and aware throughout the entire procedure. The sound of the drill grinding through bone created a noise so distinctive that survivors would be haunted by it for the rest of their lives. The crude nature of 19th century drilling equipment made the procedure extraordinarily dangerous. Hand-operated drills would frequently bind in the bone, requiring surgeons to apply enormous pressure while patients screamed in agony. The drill bits were often dull from repeated use, creating rough, jagged holes rather than clean openings. Bone fragments would fall into the brain cavity, causing additional trauma that often proved fatal. During the American Civil War, over 200 trepanation procedures were performed with a mortality rate of 57%. Those who survived often suffered severe neurological damage, spending the rest of their lives with cognitive impairments, seizures, or partial paralysis. The procedure was so dangerous that even military surgeons, accustomed to battlefield medicine, expressed reluctance to perform it except in the most desperate circumstances. The psychological impact of conscious brain surgery cannot be overstated. Patients could feel the drill penetrating their skulls, could hear the grinding of metal against bone, could sense the surgeon's instruments moving inside their heads. Many developed what we would now recognize as severe post-traumatic stress disorder, experiencing nightmares and panic attacks for years after their operations. Some became catatonic from the trauma, retreating so deeply into themselves that they never fully returned to normal consciousness. The justifications for trepanation revealed the dangerous combination of medical arrogance and primitive understanding that characterized 19th century practice. Physicians believed that mental illness was caused by pressure building up inside the skull, and that drilling holes would provide relief by allowing evil humors to escape. Headaches, epilepsy, depression, and even criminal behavior were all treated with trepanation, as if a hole in the head could solve complex neurological and psychological problems. The surgical instruments used for trepanation were essentially torture devices. The trephine, a circular saw with sharp teeth, would be twisted by hand to cut through bone. Hay's saw, a straight blade designed for scraping, would be drawn back and forth across the skull until it wore through to the brain cavity. Both instruments required enormous physical force to operate, and surgeons would often recruit assistants to help apply the necessary pressure, while patients struggled against their restraints. The aftermath of trepanation was as horrifying as the procedure itself. Open holes in patients' skulls would become infected with alarming frequency. Pus would drain from the openings, creating a constant source of contamination. Many patients developed brain abscesses that were even more dangerous than their original conditions. Those who survived the immediate post-operative period often lived with permanent disabilities that made their previous problems seem insignificant by comparison. Even when trepanation was performed for legitimate medical reasons, such as removing bone fragments after head trauma, the lack of antiseptic practices made success unlikely. Surgeons would reach into open skull cavities with unwashed hands, contaminating brain tissue with bacteria from previous patients. The operating environment was so unsanitary that infection was virtually guaranteed, turning what might have been life-saving procedures into death sentences. The persistence of trepanation, despite its obvious dangers, demonstrates how medical tradition could override empirical evidence. Physicians continued performing the procedure because it had been done for centuries, not because it produced good outcomes. The authority of ancient practice was considered more reliable than the evidence of their own eyes. Even when mortality rates approached 60%, surgeons convinced themselves that the deaths were due to the severity of the underlying conditions rather than the brutality of their interventions. The normalization of such extreme procedures reveals something deeply troubling about how societies can adapt to accept the unacceptable. When suffering becomes routine, when agony is presented as necessary for healing, people develop a disturbing capacity to witness torture without recognizing it as such. The medical establishment had created a culture where causing pain was not just acceptable, but virtuous, where the screams of patients were interpreted as the sounds of healing rather than torture. This cultural blindness extended to the families of patients who witnessed these procedures. Parents would hold down their children during trepanation, convinced that they were helping rather than enabling abuse. Spouses would comfort their partners through bloodletting sessions that drained the life from their loved ones. The authority of medical expertise was so complete that people suppressed their natural instincts to protect those they cared about from obvious harm. The economic incentives of 19th century medicine also played a role in perpetuating these brutal practices. Physicians were paid for their services regardless of outcomes, creating a system where more invasive procedures generated more income. The worse a patient's condition became, the more treatments they would require, and the more money their doctor would earn. This perverse incentive structure encouraged aggressive interventions that often made problems worse rather than better. The lack of any meaningful oversight or accountability meant that physicians could experiment on patients with impunity. There were no medical boards to investigate suspicious death rates, no licensing requirements that could be revoked for incompetent practice, no legal mechanisms for patients to seek compensation for medical malpractice. Doctors operated in a consequence-free environment where their authority was absolute and their methods unquestionable. This combination of cultural acceptance, economic incentives, and lack of accountability created the perfect conditions for a systematic medical abuse. Patients were trapped in a system that presented torture as healing, that demanded submission to procedures that were more likely to kill than cure, that treated human beings as experimental subjects rather than fellow human beings deserving of compassion and respect. The legacy of 19th century medical practices extends far beyond the specific procedures themselves. The institutional structures that enabled such widespread abuse continue to influence modern healthcare in subtle but important ways. The hierarchical nature of medical training, the resistance to questioning established authority, the tendency to prioritize protocol over patient welfare, all have roots in the medical culture that produced these horrific treatments. Understanding this history is crucial, not just for appreciating how far medicine has progressed, but for recognizing the ongoing potential for similar abuses when authority goes unchecked and suffering becomes normalized. The physicians who performed these procedures were not monsters, but ordinary people operating within systems that had lost sight of their fundamental purpose. Their example serves as a warning about what can happen when the pursuit of knowledge becomes divorced from basic human compassion. The transformation of medicine from this chamber of horrors to the relatively safe practice we know today didn't happen overnight. It took decades of courageous physicians willing to challenge the established order, often at great personal cost to their careers and reputations. The resistance they faced reveals just how deeply entrenched these brutal practices had become in medical culture. When Dr. Ignaz Semmelweis proposed in the 1840s that doctors should wash their hands between patients, the medical establishment didn't just reject his ideas, they destroyed him professionally. Semmelweis had observed that maternity wards staffed by doctors had mortality rates 3 times higher than those staffed by midwives. The difference was that doctors performed autopsies in the morning and delivered babies in the afternoon, carrying deadly bacteria from corpse to living patient on their unwashed hands. His colleagues were so offended by the suggestion that their gentleman's hands could be unclean that they had him committed to a mental asylum, where he died at age 47 from beatings administered by guards. The medical establishment had literally killed one of its greatest reformers, rather than admit their methods were flawed. Similar fates awaited other pioneers who dared question medical orthodoxy. Dr. John Snow, who correctly identified contaminated water as the source of cholera outbreaks in London, was ridiculed and ostracized by his peers who insisted the disease was caused by bad air. His life-saving discoveries were ignored for decades, while thousands continued to die from preventable disease. The echoes of these medical horrors remind us that progress is never inevitable, that compassion must be consciously chosen over convenience, and that questioning authority isn't rebellion but responsibility. The physicians who inflicted these torments weren't evil. They were ordinary people who lost sight of their fundamental duty to do no harm. Today, as we face new medical frontiers and ethical challenges, we must remember that the screams from those 19th century operating theaters serve as more than historical curiosity. They are a warning that whenever we stop seeing patients as human beings deserving of dignity and care, we risk repeating the darkest chapters of medical history. The real cure for such systematic cruelty isn't just better techniques or cleaner instruments, but the simple recognition that behind every medical decision lies a human soul worthy of our deepest compassion and respect.